More than 1 in every 2 men over 40 faces some degree of erectile dysfunction. By the time they reach 60, that number increases considerably. However, instead of talking openly about it, most men live with this situation in silence, blaming themselves or seeking quick fixes that only mask the symptoms. But what if I told you that a natural and simple nutrient, taken at the right time of day, could not only restore your vitality, but also improve the quality of your sleep and reclaim some of the energy you thought was lost forever? This has nothing to do with miracle pills or empty promises. It's about better understanding your own body, how your hormones, circulation, nerves, and sleep are deeply interconnected, and how a specific vitamin taken at night can play a surprisingly important role in restoring that balance. Think of it as nurturing the soil instead of just watering the plant. When the soil is well nourished, everything else grows stronger. That's where things start to get interesting. Men over 60 often face a triple challenge. First, testosterone naturally declines, which can affect both desire and energy. Second, the ability to get deep, restorative sleep diminishes, making nighttime repair processes harder. And third, circulation, which is essential for potency, becomes less efficient with age, especially if conditions like diabetes, hypertension, or an enlarged prostate are present. This creates a negative cycle. Poor sleep weakens hormonal balance. Weakened hormones affect sexual function, and reduced sexual function can erode confidence, leading to more stress and even worse sleep. The good news is that this cycle can be broken. Modern research shows that certain nutrients, when taken at night, can work in harmony with your body's natural rhythm, improving sleep quality, restoring hormonal balance, and strengthening the vascular system that supports sexual function. There's one nutrient in particular that we'll focus on today, which has been studied for its role in improving both potency and sleep quality in men over 60. Throughout this content, we'll explore the science behind this vitamin, how it works, why the timing of taking it is so crucial, and what the best research tells us. We'll also debunk common myths, discuss real-life cases, and offer you practical, simple steps you can start applying tonight. You deserve clarity, not fear. You deserve solutions that make sense. And most importantly, you deserve to know that these challenges aren't a sign of failure. They're a natural part of aging that can be managed with knowledge and care. Let's start our conversation with a key concept: the connection between sleep and testosterone. Many men are surprised to discover that testosterone isn't just a hormone tied to masculinity or sexual performance. Dr. Juliana Silva, with over 30 years of experience, shares these insights to help you better understand how to improve your well-being and face these changes with confidence. It's also deeply linked to how your body repairs itself during the night. Think of it as your organism's nighttime repair crew. Just as workers need quiet time to rebuild a road, your body needs deep, uninterrupted sleep to restore testosterone levels. That's what the research confirms. A landmark study from the University of Chicago showed that even 1 week of restricted sleep, sleeping just 5 hours per night, reduced testosterone levels in young men by nearly 15%. To put that in context, it's equivalent to aging 10 to 15 years in just 7 days, simply from not sleeping enough. Now imagine how fragile that balance becomes at 60, when natural testosterone production is already declining. Another key point is that testosterone is released in pulses during the night, with the highest peak occurring in the early hours of deep sleep. If you're dealing with insomnia, frequent nighttime urination, or restless leg syndrome, you may be interrupting the exact window when your testosterone has the best chance to recover. That's why many men notice that when they sleep poorly, their energy, desire, and potency drop almost immediately. Think of it like trying to charge your phone with a faulty outlet. If the current gets interrupted every hour, the battery never fully charges. In the same way, when deep sleep is disrupted, your testosterone battery stays half full, no matter how healthy your diet or exercise habits are. That's where stress comes in too. Cortisol, the stress hormone, rises when sleep is interrupted. Elevated cortisol directly inhibits testosterone production in the testes. This means poor sleep doesn't just reduce your body's ability to produce testosterone, it also boosts a hormone that actively blocks it. It's a double blow to your vitality. So, what can be done? The first step is understanding that prioritizing sleep isn't optional if you want to maintain vitality after 60. Your body's sexual function depends on the sleep cycle just as much as on blood flow. And here's the key. When we incorporate certain vitamins or minerals at night, we're not just helping you sleep better, we're protecting your hormonal rhythm. By supporting sleep quality, we allow the body to naturally restore testosterone, which in turn benefits sexual health and overall vigor. If this connection makes sense to you, I invite you to like this video. It lets me know this kind of detailed information is valuable to you. And if sleep has been a challenge in your life, comment below so we can start a conversation. You're not alone in this struggle, and there are real, science-backed solutions. When most people think of melatonin, they associate it with a simple sleep aid, a little pill that makes it easier to fall asleep. But melatonin isn't just a sedative. It's a hormone, naturally produced by your pineal gland in response to darkness. For men over 60, melatonin plays a far more important role than just helping you sleep. It influences sexual health, nitric oxide signaling, and even prostate function. That's what the research shows. Study after study demonstrates that melatonin interacts with the testes, helping regulate testosterone production and protecting cells from oxidative stress. In another study from the National Institutes of Health, it was highlighted that melatonin improves endothelial cell function, the inner lining of blood vessels. Why is this important? Because a healthy endothelium allows for the release of nitric oxide, the body's natural chemical messenger for erections. Without it, potency isn't possible. Think of nitric oxide as the green light at a traffic signal, telling blood to flow toward the penis. If that light never turns green, traffic stops. Melatonin helps keep that signal working by protecting the blood vessel lining. This means taking melatonin at night isn't just for better sleep. It's also for maintaining the foundation of potency. Now, let's talk about the prostate. Recent research suggests melatonin may have protective effects on prostate tissue, potentially reducing inflammation and improving urinary symptoms in men with benign prostatic hyperplasia. While the evidence is still developing, it points to an additional benefit of ensuring melatonin levels aren't chronically low. The reality is that melatonin production naturally declines with age. By 60, your levels may be only half of what they were at 20. You might be wondering if all men should start taking melatonin supplements. The answer is more nuanced. For some men, a low dose, usually 1 to 3 milligrams, taken 30 to 60 minutes before bed, can be beneficial. Higher doses aren't always better and can sometimes cause a hangover feeling or disrupt sleep patterns. The goal is to support the body's natural rhythm, not overload it. Here's a practical tip. Think of melatonin as a gentle reminder to your body. Dim the lights at night, turn off screens an hour before bed, and, if your doctor agrees, consider a small dose of melatonin as part of your nighttime routine. By doing so, you're signaling to your body that it's time for deep rest, the kind that renews testosterone, repairs blood vessels, and restores sexual vitality. If this information made sense to you, leave a comment below. Many men feel uncomfortable talking about sleep supplements, but the truth is that melatonin isn't a crutch. It's a natural hormone that declines with age, and sometimes a small boost can restore both your nights and your potency. When we talk about vitamin D, most people think of sun and bone health. It's often called the sunshine vitamin because the body produces it when skin is exposed to ultraviolet light. But vitamin D is much more than that. For men over 60, it acts more like a hormone than a simple vitamin. It influences testosterone levels, vascular health, immune balance, and even emotional stability, all of which are crucial for both potency and overall vigor. That's what the research shows. A study published in Hormone and Metabolic Research found that men with adequate vitamin D levels had significantly higher testosterone compared to those who were deficient. Another review in the Journal of Clinical Endocrinology and Metabolism highlighted that vitamin D deficiency isn't just linked to low testosterone. It's also associated with higher rates of erectile dysfunction, as vitamin D supports endothelial function. That inner lining of blood vessels is essential for nitric oxide release. Without healthy endothelial cells, blood flow is impaired and potency suffers. Now, enter the topic of timing. Vitamin D is fat-soluble, meaning it's best absorbed with meals containing some healthy fat. While most doctors recommend taking it in the morning or midday to mimic sun exposure, some recent research suggests that for men with sleep issues, nighttime supplementation may indirectly support melatonin rhythms. That's because vitamin D regulates the circadian system, the body's internal clock that governs both sleep and hormone release. Think of it as resetting your body's wristwatch, ensuring everything from testosterone production to vascular repair happens at the right time. Another important point is mood. Men with low vitamin D levels often experience fatigue, irritability, or depressive moods. Depression and low testosterone often go hand in hand, and both can rob a man of his sexual vitality. By restoring vitamin D levels, not only can testosterone improve, but mood and energy often follow. This creates a positive cycle: better sleep, better mood, and greater potency. Let me explain with a simple analogy. Imagine trying to plant a garden in dry, exhausted soil. No matter how good the seeds are, they won't thrive. Vitamin D acts like rainwater, nourishing the soil so everything, hormones, circulation, energy, can take root. When men restore their vitamin D levels, many notice their body feels younger. Not because age is reversed, but because the organism finally has the basic resources to function as it should. Practical tip: if you're over 60, ask your doctor to check your vitamin D levels with a simple blood test called 25-hydroxyvitamin D. Many men are surprised to find they're deficient, even if they spend time outdoors. If supplementation is needed, consult your doctor about the right dose for your body. Some men get better results with smaller daily doses, while others benefit from higher weekly doses. If your doctor agrees, taking it at night with dinner, especially if that's your main meal containing healthy fats like olive oil, salmon, or avocado, can improve both absorption and your nighttime rhythm. Remember, it's not about achieving perfection. It's about giving your body one of the most essential tools to keep your testosterone, sleep, and potency aligned. If I had to pick one mineral that deserves more attention in men's health, especially after 60, it would be magnesium. Often called the relaxation mineral, magnesium is involved in over 300 biochemical reactions in the body, yet nearly half of older adults are deficient in it. Why is it so important for potency, vigor, and deep sleep? Because magnesium directly influences nerve function, muscle relaxation, stress hormone control, and even blood vessel dilation, all essential for erections. That's what the research demonstrates. A study published in the Journal of Research in Medical Sciences found that magnesium supplementation was linked to better sleep quality, especially in older adults with insomnia. Another article in Biological Trace Element Research revealed that men with higher magnesium levels also had elevated testosterone compared to those who were deficient. And when it comes to erections, magnesium supports nitric oxide synthesis, the same pathway that allows blood to flow freely to the penis. Without enough magnesium, blood vessels stay tense, and smooth muscle relaxation, a key part of achieving an erection, is impaired. Think of magnesium as the oil that keeps a machine's gears running smoothly. Without oil, the gears grind, seize, and eventually stop. In the body, that translates to tense muscles, restless nights, and poor blood vessel relaxation. With sufficient magnesium, the system flows more freely, sleep becomes deeper, stress hormones drop, and erections become easier to achieve. Another key role of magnesium is its effect on cortisol, the stress hormone. Chronically elevated cortisol disrupts both sleep and testosterone production. Magnesium helps regulate the hypothalamic pituitary adrenal axis, the body's stress response system. By calming that axis at night, magnesium allows the body to enter deep, restorative sleep while creating a more favorable hormonal environment for testosterone production. How do you get more magnesium? Dark leafy greens, nuts, seeds, and whole grains are excellent sources. But here's the challenge. As we age, intestinal magnesium absorption decreases, and common medications like diuretics or acid blockers can increase losses. That's why supplementation may be necessary in some cases. Among the various forms, magnesium glycinate and magnesium citrate are often best tolerated at night. They're well absorbed and promote relaxation without digestive discomfort. Practical tip: consider taking magnesium about an hour before bed, preferably with a light snack or warm herbal tea. This signals to your body that it's time to unwind. Many men report not only falling asleep faster, but also experiencing fewer nighttime awakenings. Over time, this deep, consistent sleep helps stabilize testosterone levels and improve vascular function, which is crucial for potency and vigor. So far, we've covered hormones and sleep, but there's another key piece to this puzzle: circulation. At its core, potency is a vascular event. Erections happen when blood vessels open and allow blood to rush into the penile tissue, where it gets trapped and stays firm. Without healthy circulation, even normal testosterone levels won't guarantee strong erections. That's why men with diabetes, hypertension, or atherosclerosis often struggle with erectile dysfunction, even if their hormones are in the normal range. The research confirms this. The molecule that makes erections possible is nitric oxide, produced by the blood vessel lining. Nitric oxide signals the smooth muscle in the penile arteries to relax, allowing blood to flow. A study published in the American Journal of Cardiology emphasized that erectile dysfunction is often one of the first warning signs of vascular disease, sometimes appearing years before heart problems. In other words, your erection is like a window into your vascular health. Now, how do sleep and vitamins fit in? During deep sleep, the body repairs endothelial cells, the same blood vessel linings that produce nitric oxide. Nutrients like melatonin, vitamin D, and magnesium support this process. Melatonin protects those cells from oxidative stress. Vitamin D enhances their responsiveness, and magnesium helps smooth muscle relax so nitric oxide can do its job. Taken together at night, these nutrients work during the exact hours when the body is programmed to repair blood vessels and restore vascular tone. Think of it as fixing a dam overnight so water flows freely the next morning. If the dam is cracked or clogged, the water backs up. Similarly, if the blood vessel lining isn't healthy, erections don't happen. But with consistent repair work, blood flows with force and reliability. There's yet another layer to this process. Nitric oxide production naturally declines with age, starting around 40 and accelerating towards 60. That's why many men notice erections aren't as firm or reliable as before. But this decline isn't irreversible. Studies show that lifestyle factors like sleep quality, exercise, and nutrition can boost nitric oxide availability. For example, regular aerobic activity improves endothelial function, while magnesium and vitamin D support the enzymes involved in nitric oxide production. Practical tip: combine nighttime nutrient support with daytime habits that favor circulation. A brisk walk, deep breathing, and pelvic floor exercises help improve blood flow. By adding magnesium, vitamin D, or melatonin at night, you amplify those daytime gains, giving blood vessels the tools they need to repair while you sleep. Yes, the big picture is that potency isn't just about testosterone or desire. It's about whether your vascular system is healthy enough to deliver blood when the body calls for it. And that nighttime repair window, supported by specific nutrients, is one of the most powerful and underappreciated strategies men over 60 can use to preserve vigor and confidence. We've covered a lot, from sleep and testosterone to melatonin, vitamin D, magnesium, and the crucial role of circulation. Now let's pull it all together into something simple and practical, because knowledge is only valuable when it translates to actions you can take tonight. Think of your nighttime routine as a restoration ritual. At 60, your body doesn't recover as quickly as it once did. So you need to send deliberate signals and resources to ensure it repairs properly overnight. That's where the combination of nutrients we've discussed becomes so powerful. That's what research and clinical experience suggest. Step 1. Dim the lights and reduce screen exposure an hour before bed. This allows your natural melatonin rhythm to rise. If your doctor approves, consider a low-dose melatonin supplement, usually 1 to 3 milligrams, 30 to 60 minutes before lying down. This supports sleep onset and endothelial cell protection. Step 2. Ensure your vitamin D levels are adequate. If you're deficient, supplementation, sometimes taken at night with dinner, can help regulate your circadian rhythm, support testosterone, and maintain vascular health. Remember, vitamin D is fat-soluble, so pairing it with healthy fats like olive oil, salmon, or avocado improves absorption. Step 3. Consider magnesium. A form like magnesium glycinate or citrate, taken an hour before bed, can lower stress hormones, relax blood vessels, and enhance sleep quality. Many men notice that this single change reduces nighttime awakenings and restores morning vitality. Step 4. Combine these nutrients with sleep hygiene. Keep your bedroom cool, dark, and quiet. Avoid caffeine after noon. If the need to urinate interrupts your rest, limit fluids 2 hours before bed, and discuss prostate-friendly strategies with your doctor. Together, these steps create a nighttime rhythm where your hormones, blood vessels, and nervous system align to maximize repair and restoration while you sleep. This isn't about chasing a perfect supplement combo. It's about choosing the right tools to meet your body's needs after 60. Melatonin tunes your circadian clock. Vitamin D nourishes hormonal and vascular balance. And magnesium calms and relaxes. While you sleep, your body does the rest. Think of it as programming your organism's nighttime repair crew. Instead of leaving them with broken tools and low energy, you provide everything they need to restore strength, potency, and vigor. Over weeks and months, this nighttime habit can shift the cycle from decline to resilience, not reversing age, but helping you age with vitality and confidence. And here's the most encouraging part. This process doesn't have to be expensive or complicated. It doesn't require secret formulas or drastic interventions. It's simply about restoring what your body is gradually losing at the time of day when it's naturally programmed to heal. So, as you reflect on what we've discussed, ask yourself, what small change can I start making tonight? Is it dimming the lights earlier, talking to your doctor about checking vitamin D, or adding magnesium to your nighttime routine? The power lies in those consistent small steps. That's why here's the one action I encourage you to take today. Pick one small nighttime habit to start. Whether it's reducing lights earlier, chatting with your doctor about testing vitamin D, or adding magnesium before bed. Start with a single step. Over time, consistency matters more than intensity. Small nighttime changes turn into powerful results. You don't need to fear your body. You just need good information, the kind that empowers you to make confident decisions instead of feeling confused. That's my goal here, to bring evidence, clarity, and encouragement. Stay curious, stay informed, and most importantly, stay committed to your own health. If this was helpful to you, subscribe for more straightforward, evidence-based content, because this is the kind of conversation I have with men in the clinic every day, and I want you to benefit too. See you in the next video. Until then, remember, your nights can be restorative, your mornings can be strong, and your health can be nourished at any age.